COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. The Nigeria Center for Disease Control approves more private laboratories to test for coronavirus in Nigeria. Some student associations in Delta State decry alleged COVID-19 levy on students by some tertiary institutions in the state, ask governor to scrap it. And World Health Organization casts doubts on remdesivir for use as coronavirus treatment. While the world continues to fight the coronavirus pandemic, the U.S. and India have confirmed over 7 million cases, with the U.S. approaching 8 million. Brazil is in third place with over 5 million cases, and Russia over 1 million. Global figures stand at over 39 million confirmed COVID-19 cases. Africa is still seeing a steady rise in cases. 10 countries account for 86%, that's over 1.5 million of reported COVID-19 cases, with countries in the African region like South Africa, Ethiopia, Nigeria, Algeria, Ghana, Kenya, Cameroon, Cote d'Ivoire, Madagascar and Zambia. This excludes the Eastern Mediterranean region, while South Africa accounts for 56% of the cases. In Nigeria, the NCDC announced 148 new cases from 13 states and the Federal Capital Territory, with Lagos leading at 66 cases, followed by the FCT 25. And some of the other states you can see there on your screen. Till date, confirmed cases are at over 60,000 that have been confirmed, and we have discharged 52,194. In the meantime, 2 new labs have been accredited for inclusion into the private fee-paying labs for COVID-19 testing, both in Abuja, which brings the number of private laboratories testing for COVID-19 to 21. And that's 9 in Lagos, 1 each in Kano, 1 in Imo as well, 7 in the FCT. We have 2 in Edo and 1 in Anambra State. 6 corporate labs also exist across the Southwest, South-South and the Southeast. And over 60 government-owned laboratories are in the NCDC lab network. And amid the COVID-19 pandemic, the End SARS protest by Nigerian youth continues today. Its 10th day in Abuja, Lagos, Ogun, Edo, Imo State, Nasarawa, with major roads blocked. In the nation's capital, protesters defy the FCDA Security Committee order banning street demonstrations from the Unity Fountain to the Abuja City Gate. On their way, they stopped their march while some of the protesters took some time to observe Jumat prayers.
Allahumma rabbana wa lakal hamdu. Allahu Akbar.
They had earlier converged on the Unity Fountain, with some of them dressed in black, wearing face masks in line with the COVID-19 protocols. Yesterday, the protesters stormed the National Complex, where they refused a Senate delegation that came out to receive them. Now, in Lagos, some of the protesters also gathered at the House of Assembly Drive at Alausa to continue their agitations. They came fully prepared with water, various food items also to be shared among the protesters. There was also a waste disposal truck parked to evacuate refuse generated from the scene.
What do you want? End police brutality. 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 End police brutality.
brutality. Yes. Henceforth. He's a bad boy.
No, that day I was. Then on my way home,
And in the meantime, protesters have also blocked the road that's coming into and from the Nnamdi Azikiwe International Airport that's in Abuja. News just in, protesters blocking the road from and to the Nnamdi Azikiwe International Airport in Abuja. Now, just as in Abuja, protesters also took time off to observe Jumat prayers in Lagos. The Delta State chapter of the National Association of Nigerian Students and the National Executive of National Association of Delta State Students have alleged a 5,000 naira levy on every student by some tertiary institutions in the state for COVID-19 prevention and safety materials. During a courtesy visit to the governor of Delta State, the students called on the governor to direct the institution to scrap or reduce the COVID-19 levies.
Delta State is, if not the only state, one of the few states that are still paying bursary. And the students don't take that for granted. So, sir, this year bursary, the registration was done earlier this year, and there is a policy in the board, which is the physical verification. I've written to your officer that if there is a way it can be romanced because of the pandemic that does not support large gathering these days, asking for students to come together for physical verification is like bringing so many crowds together again. We are begging and we are appealing, sir, that it should be, if it can be, not bypassed, I say, but romanced so that it can be reduced to the barest minimum, where this bursary will still be paid without the physical verification.
I'm aware and I'm told that you already have meetings with the Commissioner for Higher Education concerning the issue you've raised on the COVID-19 pandemic. And though the institutions are near, I use the language very carefully, they are near autonomous. So that is what they did is a decision that they took on their own, not on my table. And I cannot just rise up to take decisions on the table, but we'll discuss it. I'll discuss it with the commissioner. And if it's not possible to scrap it, I'll try to push for them to go down on the amount of money that is requested.
Now, the Archbishop of Anglican Communion Northeast has appealed to the federal government not to slow down but intensify its efforts in the fight against COVID-19. Despite the low cases being recorded across the country, the Anglican Archbishop made the comments during the commissioning of a new Secretariat of the Communion and celebration of 30 years of the Yola Diocese. According to him, full-blown community transmission is still ongoing. He's also appealing to authorities to ensure that palliatives get to the people. For more on flattening the coronavirus curve, we have joining us from Abuja, that's via Skype, Dr. Walter Mulombo. He's the World Health Organization country representative. We'd like to thank you for joining us on the program. I'd like to begin with the response in Nigeria. Since you became country officer, how would you assess it and the declining cases of COVID-19?
Thank you very much for your question, and thank you for having me on this program. I joined Nigeria in mid-June, where the epidemic, the COVID-19 epidemic was still at its peak, more or less. So I joined the country where the presidential task force was already activated. So I basically hit the ground running. I was able to assess the measures that were put in place from the airport to where I went into quarantine and other public health measures. So I found a very well-organized response, to say, with an effective public health emergency operating center, operating a full regime with support from other partners like US CDC and of course my colleagues from WHO. So I've been looking into the way the trends and the cases as they were evolving week by week. So I can say that Nigeria is mounted an effective response. And this we could see because, as you know, there were some predictions that some countries in Africa, namely Nigeria, South Africa, and Egypt, will face a catastrophe. We didn't see that catastrophe in Nigeria, but we are seeing the contrary. Cases continue to going down, even if over the last few weeks the decline has kind of stalled over.
A technical lead on COVID-19's WHO, Maria Van Cove, say that the WHO doesn't and didn't recommend lockdowns, rather a comprehensive approach which includes a do-it-all. Does that mean that countries that initiated the lockdown measures at the beginning didn't have to, and that it had no effect in reducing the transmission?
As you know, the COVID-19 is still new. We are still learning a lot from it. What WHO recommended is application of comprehensive measures, from infection prevention control, washing hands regularly, or using with water and soap, or using hand sanitizer. Respiratory etiquette, coughing in the elbow or in a tissue, and discarding the tissue, washing the hands, making sure we maintain social distancing, with talking to each other at least 1 meter distance, and avoiding crowded areas. So those measures, and together with testing and contact tracing, isolation of cases, case management, and many other measures need to be implemented in a comprehensive way. That's what WHO advised. And now we know that the epidemic started in China, and some of the measures the country took were informed by what was happening in China at the beginning of this pandemic. You know that China had one of the most stringent, lockdown measures. So overall, public health measure advised by WHO still hold, and the turnaround, the measure of getting off over.
Let's ask about vaccines. Remdesivir has been touted as a potential therapy since the beginning of the pandemic. But now, it also formed part of President Trump's cocktail of treatments. But tell us, from WHO's perspective, does it have a life-saving effect at all?
Yeah, as you know, WHO launched the Solidarity Trial and advised countries and researchers to come together and test new tools and treatment and therapeutics, so that evidence could be collected and, if proven scientifically, could also be included in WHO guidelines. You know, WHO has a stringent review committee of experts who review evidence when it's come out of the clinical trial. So remdesivir is one of those medicines that have been tested in some circumstances, particularly for patients that were admitted. So has evidence accumulated? So recent studies suggest that the effect that was anticipated, the protective effect, or the effect on the duration of hospitalization or on the mortality was not really what we were expecting for this medicine following the initial trial, which were based on a smaller sample. But now there are larger clinical trials which has demonstrated that the impact might not be the one that was expected. Having said that, there is a WHO review committee who will review the evidence and come up with recommendation also whether we should use that drug in the context of COVID-19 or not.
Right, Dr. Wat Mulombo, the World Health Organization country representative, would like to thank you for joining us on the program. Wish you a safe stay in Nigeria.
Welcome.
The European Union says preserving access to safe and nutritious food will continue to be an essential part of the response to the COVID-19 pandemic, particularly for vulnerable communities. According to the EU, over 2 million people do not have regular access to safe, nutritious and sufficient food at the moment, adding that the virus could add between 83 to 132 million people to the figure.
It is pertinent to recognize and support the state food heroes comprising of farmers and workers throughout the food system, making sure that food makes its way from farm to the populace in unprecedented time of the current COVID-19 crisis in a more transforming means of sustaining livelihood. Our future food systems need to provide affordable and healthy diets for all and decent livelihoods for food system workers while preserving natural resources and biodiversity and tackling challenges such as food preservation and climate change. Over 2 billion people do not have regular access to safe, nutritious, and sufficient food. The global population is expected to reach almost 10 billion by 2050. Nearly 690 people are hungry, with up to 10 million since 2019. The COVID-19 could have added between 83 to 132 million people to this number, as dependent on the economic growth scenario. Approximately 14% of food produced for human consumption is lost each year between the stages where it is grown or raised up to when it reaches wholesale market.
The global coronavirus crisis now a time to reflect. Well, partial lockdowns are continuing, and this is across Europe as governments battle to reduce the spread of COVID-19. Stephen Beardsey, Deutsche Welle correspondent in Berlin, joins us now. Hi, Stephen. How bad is the surge in infections right now across Europe?
Well, yesterday alone, we saw that multiple countries recorded records for new case numbers. Among them, Germany with more than 6,600 new cases in a single day. Also Poland, even tiny Lithuania. The real whopper, however, is France, which recorded more than 30,000 new cases in a single day. I believe the day before that was up from 22,000 in a single day. So you can see that things are spreading rapidly there, which is adding to the urgency across the EU right now. For fear that that's going to really come across borders, it has in many cases. That's why we're seeing cases rise. A lot of it is also pinned on a rise between younger individuals who are spreading it to one another, and then of course amongst families. So family visits, for example, into apartments, visits like that tend to spread it as well. So these are things that are difficult to clamp down on, and that's why you're seeing nations put in things like curfews and trying to close some of the more party venues or sort of festive venues, bars, restaurants, things like that.
The UK is also putting out a number of restrictions, but how is the EU coordinating to fight back?
Well, the EU is sort of limited in its response. There is a summit that's been taking place this week, I should say Thursday and today, Friday. That's mostly focused on Brexit, however, as you mentioned. Really, the member nations alone are the ones who are putting in the rules. The EU has done something in that it has agreed on a general map of risk areas, and that is it's agreed on the metric itself for what constitutes a risk area. That's no small feat because nations measure that differently. What they've agreed on is 50 cases per 100,000 over 14 days. That's colored most of Europe red, which is a risk area, and orange, which is also an area of concern. There's very few nations that are green. Finland, I believe, is the only one right now. And then there are a few nations that are gray because they haven't submitted their data, or their data may not correspond with the gatekeepers of the data. So again, even efforts to really coordinate sometimes don't always go that well. And there are a lot of areas where, frankly, the EU has not coordinated, including responses such as self-quarantine time. Should that be 7 days? Should that be 5 days? Should it be 14 days? Nations vary. Also in issues of mask wearing, alcohol bans, things like this are areas where there still is a lot of disagreement. It's worth mentioning here that the tourism industry across Europe has been unified in calling for general standards across Europe so that they can continue to encourage people to come under certain circumstances. What they want is testing for pre-departures, that is on flights. They want uniform rules. That's really fallen to the side now. Firstly, because not many people really want to travel right now. Secondly, because a lot of nations are essentially closing their borders or trying to dissuade people from crossing borders. And third, because all the testing capacity is not going to tourists right now, it's going to front lines. And that just goes to show how serious things are here, that those issues are swept to the side, more or less.
But finally, Stephen, what does this new wave of infections mean for businesses that haven't even recovered from the first wave in spring?
That's going to be the real challenge. That's what's facing member nation leaders right now. If you look at France, for example, President Macron has not instituted a general lockdown across the nation. Instead, he's chosen a piecemeal lockdown of particular states and cities that are especially high infection numbers. He said that a total lockdown would be disproportionate. And again, he's walking that balance between trying to not harm businesses or not overly harm businesses that are still yet to recover from that spring wave, while also answering the calls from epidemiologists who are saying something critical needs to happen right now. In the case of France, it's a curfew between 9 p.m. and 6 a.m. Now, just imagine in Europe, as in many nations, but especially in Europe, finishing your dinner by 9 p.m. and then being given the boot. Of course, he's getting an earful from a lot of restaurateurs in Paris, the capital perhaps of the cafe scene and dining. So you can imagine how difficult it is there. But other nations are doing the same. Brussels has closed cafes and restaurants for a month. Germany has also instituted a curfew in parts across certain states. Here in Berlin, where I am, for example, they must close at 2300. That's also difficult, even though it's not a 9 p.m. That really limits what you can do as a bar, for example. A friend of mine actually runs a craft brew pub here in Berlin, and he said that what he wants is certainty, and that's something that's very difficult to find right now because he's not sure if he should brew beer for his kegs, for example, which would be to serve people at the premises, or if he should brew it for bottles, which he would then distribute to stores, things like that, considering that his pub would likely be closed. So without a clear signal, then you don't really know how to prepare, and without being able to prepare, then you're in trouble for the weeks ahead, and that's what all businesses across Europe are facing right now.
Been Deutsche Welle correspondent. Stay safe. Talk to you again soon. Meanwhile, the UK Prime Minister says if at all possible, he wants to avoid another national lockdown. Boris Johnson says each day that passes without action around the UK will mean more people dying. Well, according to the NCDC, washing hands with soap, running water is vital to reducing the spread of COVID-19. Of course, don't forget to take responsibility as you go out. And you can find more updates on our website. That's channelstv.com. You can see the latest stories on the pandemic from the WHO there, Remdesivir, and several other stories that we are following across Nigeria and the world. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.